I'm just delighted. Thank you for battling Dallas traffic to get here. We totally understand what happens I drive that Central Expressway every time down here from McKinney's, so I feel your pain. I'll introduce Sylvia, who is another one of our board members, and we're so glad she's here. If you want to just do your intro, and then anyone that we've missed, if you want to introduce yourself, and then we'll give it over to Stacie.
Hi, I'm Sylvia Lopez, again, part of the MHA board. I'm also the co-founder of the Lone Star State School Counselor Association, where we serve probably about 3,000 Texas school counselors.
Hello, everybody. Good morning. Please forgive my tardiness.
Like I said, it's Dallas.
My name is Tracy Brown, and I am a licensed therapist. I am currently the executive director of mental health services for Dallas IC, but I'm like 2 weeks out of away from retirement. 30 years, yes, 30. But thank you for having me.
Did anyone else come in that wants to introduce and tell us from where you're from? I kind of lost you in all the musical chairs. Anyone? Did you want to say something?
Okay.
Oh.
Hi, everybody. I'm Kayla Sobel. I'm the manager for physician services at
Anyone else?
Marianne Weststop. I'm the substitute over at UCLA.
Okay. Wow, we have such a great group here. Thank you so much. It's so exciting for us to see all of you. Our information, if you want more information about MHA or Greater Dallas, look at the very back of the room. Make a look by there before you leave. Grab a snack, grab a water, and see any of us. And feel free after the meeting, feel free to linger and talk, because some of the best networking happens right after the meeting, before the meeting. So now I believe we're ready to turn it over to Stacie Goran, and we are so excited to introduce her and welcome her for Children's, and she is our subject matter expert on substance abuse trends at Adolescent. Welcome, Stacie.
It's so cool to hear how many of you guys already work in substance use, and so I would love for this to be conversational instead of me just telling you things you already know. But you guys might have a different experience in what you've seen than what we see, in outpatient. I don't work in residential anymore. I have, and that is a different world a little bit. So let's just talk. How many people do work in substance use? And then how many people work with adolescents? Okay, so more adolescents, some substance. Okay, so we'll just talk about what we're seeing, what's going on with adolescents in DFW, in Texas, across the nation. Fentanyl, of course, is always a hot topic, and then how we're treating these kiddos. So SAMHSA, if you're familiar with substance use, you access the SAMHSA website on occasion. So lots of good information there. The only unfortunate part is that the most recent data on there is 2021. And I feel like since COVID, the world has changed. And so my guess, based on my experience, is that some of these numbers are actually higher now than they were in 2020, 2021, because things have just continued to kind of not get a whole lot better. So we'll talk about vaping. What is the #1 problem in these junior high and high schools right now? Yeah, everybody's shaking their head. My son started 6th grade last year, and he comes home and he's like, "Mom, why are they talking about vaping all the time?" Like, I don't get it. He was just so confused by it. I'm like, just wait, you'll see. Now he's like, "I don't like to go to the bathroom at school." I'm like, "Yeah, I told you." So yeah, the kids are vaping. They're vaping all the time. I've seen the videos where they're blowing it in the water bottles so that there's no vapor. They're using in the bathroom. Teens report that the biggest trigger is going to the bathroom at school. How do we fix that? I have no idea. These kids have to go to the bathroom. I know that there are some schools, I think it was Richardson that installed the vape detectors. I don't know how
With
well
mixed
that,
results.
yeah, I don't know how well that works, but y'all were the first ones that I've heard that it had installed the vape detectors.
So like it goes off, right? And then you have to respond to it. And if the SRO or the admin go and they're 10 kids, like, are
Yeah.
you gonna shake them all down or no?
Yeah,
So it's something.
yeah. No, it is something. Like, we have to try. It's just, nobody smokes cigarettes anymore.
No.
No, I mean, who would smoke a cigarette, right? This is so undetectable. They're using them all day long in their bedrooms at night. You know, they don't even have to hide. They don't have to open the window. They don't have to do anything. So really, really scary. We don't know what the long-term effects of vaping are. We have no idea. There's no research. There's no studies that are going to show us longitudinally what it's going to look like for people's lungs and all of these things. So really scary. We do know about EVALI, which is like the popcorn lung, that has impacted people, although that's mostly been traced back to the THC vapes. But that's another thing. You never know whether they've got a THC vape or a nicotine vape, and some of them look very, very, very similar. So why are they vaping? Because they can get away with it. Because it's, you know, it's cool, it's sneaky, they're available, you know, there's a million gas stations in DFW that'll sell them to anybody. And if they won't sell them to them, they can easily give somebody some money outside and say, hey, can you go buy me a great vape or whatever it is. So just between 20 and 22, the e-cigarettes, so any kind of electronic cigarette sales increased by 46%. So everybody probably remembers when it started, it was Juul, right? Everybody was Juul. I don't even hear about Juuls anymore, because now there's Elf bars and this and that, and they just call them vapes or disposable. So nicotine and tobacco products are illegal. You know, it used to be 18, but it's actually 21 now. And these kids are 13, 14, 15 and still able to access it as often as they want. We have no idea what the health implications are long-term. Nicotine is highly addictive, causes dependency and withdrawal. Some of the kids that we see will come in and they're like, we caught them vaping. So we'll test for nicotine. It's not our number one goal in treatment. We're focused more on the other substances they're using. But when they take that vape away from them and then they wonder why this kid is so grouchy and irritable and mean, like they're withdrawing from the nicotine. So we do have instances where we'll advise the parents, hey, if they're really testing negative, then we can give them some sort of nicotine, you know, replacement therapy, because they were obviously vaping enough that they're physiologically addicted. I mean, it's really impacting them and their moods. Y'all, teenagers anyway, if they take away something that they've been using or they're not addicted to, it's pretty rough. So this is 2022. Again, I'm interested to see 23, 24, 1 in 4 using every single day. The most common type is the disposables. You know, I think when vaping first started, you could do like the refillable and all that stuff. I don't even know if that's still a thing. I never hear about that, especially with the adolescents, because that would really entail them going into a store and having more interaction. But so the disposables are just easy. And the other thing is, we just came out of a pandemic, and these kids, what do they do with the vape? Here. They just pass them around like nothing. So, you know, wait till there's like a mono outbreak. It's not gonna be the first thing that's the vaping disease. So, and then almost 85% are using the flavored e-cigs, probably more now. What is the most common drug used among all Americans? Adults, everyone, cannabis, all day long. 2021, the most used drug is marijuana. That's probably not changed. 18.7% of Americans reported using marijuana. That is almost 20%, 1 in 5 people. That's just everyone. So pretty crazy. Highest rates of use are among young adults, ages 18 to 25, and that's 35% reported using in the last year. Second highest among 26 and older at 17%. Third highest among adolescents at 10.5%. That's 1 out of 10. Any surprises by that? Or is that just, you think it's higher?
Yes.
Okay. I do too. I do too. You know, you can only get so much information from the Adolescent. Right, right. And then I don't know how many of you access the monitoring, the future study. I always feel like that's a really good resource for what's going on with kids. You can narrow it down by zip codes, you can narrow it down by, you know, states in different areas. Really good information. They give out this anonymous study. The only year they didn't get really good information was 2020 because the kids were pulled from school and they didn't get to finish. But the 2022 information says that 8.3 are using marijuana. 30.7 of 12th graders, so a third, are reporting cannabis use in the last year. And vaping cannabis, so there's bud, weed, and then there's the vaping, the oils, the wax, all of those, you know, more high potent stuff. So 15% of 10th graders, 20% of 12th graders are reporting vaping cannabis in the last year. How much y'all know about the potency stuff? Everything? Okay, we'll talk a little bit about that. She's like, okay, so cannabis, we know what cannabis is, right? Cannabis is just a plant, has 550 different chemicals. Marijuana is part of the plant that contains the THC. THC is what people like. That's what causes the psychoactive effects, right? So THC and CBD have the same chemical formula, but they're arranged differently. So you hear a lot of people talking about, oh no, I don't smoke, but I use CBD. I'm not judging, I'm just saying, there's probably some THC in that CBD that you're using. It's very, very difficult to remove the THC from the CBD. So there are some people that will swear by, my mother swears by this lotion on her wrist that has CBD, and that's okay. But you just need to know that, you know, potentially you could be ingesting some sort of THC if you're taking a CBD product. It's Delta 9. Do y'all hear all these Delta 8, Delta 10, Delta 8, whatever? So Delta 9 is just what we've always known as the original THC. That's Delta 9. So Delta 8 and Delta 10 have popped up within the last couple of years. I'm sorry, yeah, 8 and 10 have popped up within the last couple of years. And all they're doing is just changing that chemical, like moving one little thing so that it's not illegal, because they can't keep up with making all these things illegal and following and, you know, always updating things, because these guys are smart, right? They're gonna just keep selling this stuff. So we don't know exactly what's in it. There's no quality control, you know, that the FDA doesn't go in and inspect and check these products before they're sold. But Delta 8 and Delta 10 are still THC. So if we've had kids that come in, they're like, it wasn't weed, it was Delta 8. Hence why you're still testing positive. So they will still test positive. And again, we don't know what they're doing to alter that. There's a lot of weird stuff that they do to these chemicals to extract the THC, and to some of the videos I've seen are pretty disturbing.
We saw the same thing back in the day, of designer drugs.
Yes. Yes.
MDMA, that's.
Oh, yes. Yeah. It's like, what's the base? You never know what the base is. Yeah, they just try to change things around. So, and the way that they extract the THC, the pure THC from the plant, do y'all know how they do that? Oh, it's like the craziest chemicals. It's like gasoline, and then there's like formaldehyde, and there's like weird chemicals that they use. So then they extract this THC. I probably have a slide about it in a minute, and I'm getting ahead of myself. But they extract that THC, and then people are smoking that. And you have no idea what all chemicals are in there that are going into your lungs, your blood, your body, your brain, everything. So just really scary stuff. Again, we don't know about long-term effects because it just hasn't been around long enough to have done those studies. So then we have the whole thing with ingesting. So the gummies, you know, the kids talk about the gummies and the candy and the nerds and all the different things. When Colorado first legalized years ago, the number of overdoses on THC like skyrocketed with little kids and adults too. Because what happens when you eat a gummy? It's delicious, but also like an hour later, I'm like,
Yeah.
so what do you do?
Have another.
One or two more. Same thing with the brownies and stuff, and now they sell just the butter or the oil that has the THC, so you can make anything and it doesn't taste like, I mean, when I knew back in many years ago that you would have like weed brownies, I mean, they were disgusting. Like, they were green, they were gross, like, not that I tasted them, but my experience is that they get really terrible. But it's not the same, now they're just like delicious treats, I mean, they do Rice Krispie treats, they do all kinds of crazy stuff. Yeah.
I think the name of that pretty much tells you, shipwreck.
Oh, yeah. I didn't even notice that. Yeah, I didn't even notice that, but yeah, so just really easy to take too much. And then what happens when you take too much, people are like, it's just weed. Well, no, we've kind of crossed that line. We're not just weed anymore. So this is the THC and CBD in cannabis samples seized through 2021. I have no doubt that that's gonna continue to go up. This is where they're testing the potency of the THC. So CBD has remained mostly, but you'll see it does have some THC. And then the CBD just keeps, or the THC line just keeps getting higher and higher as far as the potency of what they're finding. So before 1990, marijuana was smoked pipes. I mean, in my mind, I always like Woodstock. That's kind of where my brain goes, right? Like smoke a doobie. But you know, it was like little joints, and it was like the little pipes, and it was always the flower. There was nothing else, and the potency of THC at that point was 5 to 10%. So it was just a completely different drug. Then you go 1990s, they started doing all the indoor hydroponic growing because they could grow it so much faster and so much stronger. And then they got the potencies up to 20%. That's when they called it hydro. So if you were gonna buy weed and you wanted to buy hydro, you paid twice as much, because it was that much stronger than what they had previously. And then they started figuring out, hey, we can extract this THC. This didn't happen until, you know, the 2000s, that they're extracting it. And now potency is anywhere between 50 and 90. So to compare, like, it's just weed, when people say it's just weed, I'm like, that's 5 to 10% THC. That's just weed. This is 90% straight THC. That is not the same drug. You cannot tell me that that is even remotely the same drug. That's like comparing Advil to fentanyl. Like, it's just not, those are not the same. Maybe not. You know what I mean? Maybe a little hydrocodone. Yeah. But now with legalization, decriminalization, you know, it's being legalized all around us. And so it's gone, it's here. It's not that hard to get, and weed's never been really hard to get, but now that the products are like commercially branded and made, they're getting it here. Whether they're shipping it, driving across the border and going to get it, it's getting here. The concentrates look like wax. It's that real sticky, icky, yellow, buttery kind of looking stuff. They commonly call it dabs, wax, weed pen, carts for cartridge, or dispo. Extraordinarily high THC levels, 40 to 80% potency, some of which surpass 90. So when previously, before they started really getting into the concentrates, if we would do a THC, does anybody else do like the qualitative cannabinoid tests where you get like a THC level? Yeah, Whitney knows. So when we would do that, we knew back in the day in our minds, like if you have a 500 level, this is probably a kid that's using daily. And now we have kids that test over 5,000, and that's as high as the test goes. It won't go any, it just is greater than 5,000. And so, yeah, and so it's really, the potency is so high that before, you know, we think weed gets out of your system in 30 days. Nope, not anymore. Not if they're using this stuff. It can take 45 days to 2 months to get out of your system. I mean, we can see the levels drop really drastically if they really stop using, but then that just lingers because the levels are so high. So we've gone from 500 levels indicating daily use to now we've got kids that are just off the charts. Again, they only go to 5,000. So that's as high as our testing. So pretty crazy. Vaping THC does not produce smell. I won't say that it doesn't smell at all, but it would be easy to cover up. Not like, you know, people that I knew in high school that would have to go across the street, around the corner behind the dumpster to smoke weed because, and then they would still come back smelling like weed. They can do this in the bathroom. They can do this in their car and not come back smelling. So just really easy for them to be sneaky and get away with it. They can go take a shower at home and smoke while they're in the bathroom and their parents will not. Oh, there it goes. So a lot of times we have to ask, we'll get parents that call and say, hey, my kid's vaping. I'm like, do you know what they're vaping? You know, and parents don't know. So we always tell them, and I don't know what you guys will direct them to, but we always say first off, go to your pediatrician. If you have a regular PCP, and do a comprehensive drug screening. Not just a 12 panel, but a comprehensive drug screen. If you've noticed some odd behaviors, if you've noticed something that's going on, that's always our first step. Because if they've tried marijuana once or twice, probably not, an IOP program is not the next step. Maybe the next step is some individual therapy, maybe a support group, maybe some school interventions and things like that. But we want to see what exactly is going on. We want a comprehensive test to see if there's anything else that pops up. Because we've done that before, thinking that this kid had only smoked weed one time and then they popped for fentanyl. You know, we didn't even know that was going on. And so I think it's always important, if you have any weird suspicions that something might be going on with a kid, get a comprehensive drug screen. That's the first step for me. THC concentrates are a felony. The kids do not seem to understand this until they end up with 2 felonies because they got caught with 2 vape pens in their pocket and they were THC. And so we have multiple kids that have been caught. It's a really long process. And I think that, I know you came from Dallas PD, like it is hard to keep up with. I don't know how they're keeping up with it because it's happening so often. And a lot of these kids, you know, they're 16, maybe they're 17, maybe they're adults, but a lot of them, if they'll do a program, I know that some of those are getting dismissed, but it's a felony, guys. It's a felony. They're like, I don't know what that means. Like, let's talk about it. Prison or not prison. That's the difference. So with marijuana, the old marijuana, your grandma's marijuana, you did not see psychosis. I mean, you might see a little paranoia, but you weren't gonna see these kids that are having full psychotic episodes. How many of you are seeing those kids? Yeah. We're at any given time, and we're a pretty small program, at any given time, we have 2 to 4 kids that are fully psychotic. That are not appropriate for acute care because they're not at risk of harming themselves or anyone else, but they are completely irrational thinking, judgment really impaired, and some of those, even when they've been clean for a year, hasn't gotten better. And so, you know, was it chicken egg kind of thing? You know, was it already there and the marijuana just kind of woke it up? Would it have never been there had the, you know, potent THC and whatever else chemicals not woken it up or initiated it? We don't know. But we know that right now, when they're with us, it's substance-induced psychosis. And again, we've had kids that have stayed clean for a full year, confirmed, tested with us, and are still experiencing some psychosis after all of that. And so we refer a lot of kids to like early psychosis intervention programs once they've completed our program. But a lot of them continue to use. And so you can't, it's very hard to tease apart what's substance induced and what's organic, or what may not have ever been organic, but now it's just part of who they are. And so really, really scary stuff. I think that's the education piece that we really need to talk to these kids about. It might be fun for a minute, but these are really lasting effects. We've also, there's a million studies that show that depression and anxiety over time increase and get worse the more these kids use any substances, but especially with the cannabis, especially anxiety, which is so crazy because the kids will come in and say, it's the only thing that helps with my anxiety. And I say, you feel better in that moment, but how do you feel when you're not high? I feel terrible. Okay, so then long-term, is this really a solution? What you're doing is making it worse over time, and you get relief in that moment that you're high. But you also can't function. So we're not really fixing anything. So really trying to get them to understand that their temporary solution is really, really harming them long-term. So marijuana is addictive. I don't care what anybody says. Some people say it's not. I think anything that changes the way that you feel can become addictive. Anything that changes brain chemistry and changes the way you feel can become an addictive process for us. We're human. So cognitive impairment, a lot of stomach issues. We get calls from the ED sometimes where kids have gone in and they're just throwing up. And then we find out they've been smoking, and that is one of the effects. We have kids that have lost a lot of weight while they've been using. Again, the old weed would make you eat, right? This weed's like they don't even care to eat sometimes. So it makes kids really, really sick. So craving, tolerance, dependency, and withdrawal, that's where we know that it is addictive. 30% of people who use marijuana develop a use disorder. So that's a diagnosable disorder. And then youth who use marijuana are 4 to 7 times more likely to develop another substance use disorder. So a lot of the kids will say, well, I'll quit using everything else. I just want to still smoke weed. Well, you know, we know that if you continue to smoke weed, you will likely go back to using something else as well. And of course, we don't want you to smoke weed anyway. We want you to figure out how to be happy and healthy without the use of a substance. So fentanyl. So those tablets, these are some authentic oxycodones and these are some fake oxycodones. So I hear the term, and the psychiatrist that I work with is, he just likes to say they're not laced pills, they're fake pills. So they're not, we hear the term, they're laced with something. They're not laced, they're actually just fake pills. They're being pressed to look like another pill and they have fentanyl. And so this is what the kids think they're getting and this is what they actually get. I would say about half of the kids that have come into our program and sworn up and down that they've never used fentanyl have tested positive. And then admitted later, sometimes through a lot of discussions and building some rapport that, well, I did take that one Percocet. Okay, well that was not Percocet, that was fentanyl. And so sometimes that's enough to scare them, but we've had some kids that really, really were addicted to fentanyl too. So, you know, it depends, that's where you get to really decide what level of care is appropriate. Of course, it's coming mostly from China, through Mexico and into the US. Of course, it's highly addictive, way more potent than heroin, and 2 milligrams, the tiniest bit is potentially a deadly dose. The leading cause of death for Americans 18 to 45 is drug overdose at this time. And that's for the first time in ever, I believe. So drug traffickers are mass producing these fake pills and falsely marketing them as legitimate prescription pills. I usually hear perks. I don't know, do you guys hear anything else? Like the oxy or perk is what I usually hear that they think they're taking or they think they're buying when it's fentanyl. But some people have said Xanax and Adderall. I haven't seen that, but I'm sure that it's happening somewhere. And that's a pencil. And that's that's potentially a lethal dose on that end of that. DEA found that 7 out of every 10 pills with fentanyl contain a potentially lethal dose. The only safe medication, and tell your kids this, tell your neighbors, tell everybody, do not take medication unless they came from your mom or your doctor or a nurse at a doctor's office. Do not take pills from friends. For anything, even a headache, like just don't do it. Go to the nurse. Just don't, because right now it's everywhere. I don't know what you guys experiences, but I feel like it comes in waves. and bubbles. Like, you know, it'll come up in one area, like there was a Carrollton Farmers Branch incident, and it got really, really prevalent in that area for a little while, and then it'll kind of pop up in another bubble, and it'll get really, really prevalent. I think it's happening all the time everywhere to some extent, but I do think like the accessibility and things like that do change. And you get a new group that kind of gets involved, and then you'll have some overdoses and some events that'll happen, or maybe some kid will get busted at school. I know there was one like 7th grader that overdosed at school. He survived, but 7th grade, and these are babies. So just something to be aware of as far as like just teaching people don't take them. Dr. Atkinson that I work with says you should assume that any pill at any time that someone is giving you that did not come directly from a pharmacy, that's just what you should assume at this point in the world. So drug overdose deaths. I mean, you guys can see what happened. Here's 2020. So we have COVID, and then we have fentanyl going crazy. The blue line is primarily fentanyl. And then we have like the methamphetamine, which is still, of course, problematic, is the next one. So, but you see the fentanyl just skyrocketing for overdose deaths. And so it's really unprecedented, what's happening.
I think mixed with everything too. Like there have been cases where someone is using meth and it's laced with fentanyl.
Oh, yeah, for sure. Or they mix them. I mean, they used to mix heroin and meth, and now they're mixing fentanyl with meth. And so that is like a hot shot or something like that.
Hot shots.
No.
Hot
No,
shot
what
is
is that?
basically
I can't remember what they
purity
used to,
stuff.
what did they call it when they would mix the speedball? No. Anyway. moving on. I work with teens now, so I'm not as familiar with that lingo. Hopefully my kids aren't doing that, so I haven't made it there. So, and then this is just by sex. So totals are the blue, and then the female line is the orange line, and then it's still gonna always be more prevalent in male, I think, with the yellow line. So we've got this updated to 2022. So it did stabilize, although it stabilized really, really high. I don't know, well, it'll be interesting when they update the 2023 numbers. This was in 2022, 11.4 million deadly doses of fentanyl and 7,000 pounds of methamphetamine in 2022. That's just Dallas. Yeah. 11.4 million deadly doses. So other relevant trending drugs, there's always going to be cocaine and meth. I think those will continue to exist. Cocaine is always going to be easily accessible. We're in Texas, we're close to the border. It continues to come over. Meth, they make it everywhere, so it's a lot less expensive and lasts longer than cocaine, so they continue to use that. Other prescription medications that we see, benzos for sure, the kids like the Xanax. Although I do feel like that might be trending down. What do you guys think? Maybe because they're just smoking more weed, but I've seen a little less of the Xanax than I did maybe 5 or 10 years ago, but it's still out there. And then other opioids, of course, and then amphetamines. So they do like to trade their medications. So if somebody has ADHD medications, parents should watch them take it. Sometimes they like to stash them, give them to their friends, or sell them to their friends. They do that as well. So that's the Adderall and the Copeland and all of those good things. So hallucinogens, the LSD, PCP, shrooms, mushrooms, which have been legalized. The shrooms have been legalized in some states, so they are a little bit easier to access by mail. And I know they've had a lot of problems since they've legalized that in Oregon. Not necessarily a good choice. So we'll see how that all folds out. Actually, it hasn't been that long. How long it's been? Yeah. There's some crazy stories that have come out of that. And then I didn't even put like ecstasy in here, MDMA or Molly, that will always continue to be, a problem. So the first step when we wanna think that we need to see somebody, a parent's concerned, school's concerned, comprehensive drug screening as the first step, and then assess level of risk. So is there suicidality going on with this kiddo? Is there a dangerous situation at home? What else is going on? What other factors? Is there marijuana? Do we have a level? Do we know if this kid's using every day? What's their school environment like? Can we keep them safe? And so that would determine whether they're gonna go to a residential, an inpatient psych facility perhaps, maybe even detox first. And then, we can look at some of the outpatient programs as well, PHP, IOP, maybe just outpatient counseling as a first intervention. So our program uses a combination of theories. So we use CBT, MET, so cognitive behavioral therapy and motivation enhancement therapy. Kids are not motivated the same way that adults are. So typically when adults come to treatment, they're like, I really screwed up. Like something's happened, I lost my job, I lost my wife, I lost my kids, I lost my house. Something has happened that's really like kicked them. My freedom, that's a big one, right? And so they're ready to do something different. Not that they don't struggle, but the motivation is much, much, much different. So when kids come to treatment, very rarely is it by choice. They're usually getting dragged by their ears, by their parents, or the judicial system has encouraged them strongly to get some treatment. Sometimes the school has said you've got to get some treatment. So we have to find ways that motivate them. So our job is to dig in and figure out what the heck is going on that can motivate them. Oh, they're very into athletics. Okay, so let's really work on like this from a health perspective. Let's find we use MI, so it's like any change talk that they use. They say, I don't want to quit, but I do want to gain some weight and work out more. Okay, I hear you say that you want to gain weight and you want to work out more. So how can we twist that a little bit to see how maybe you smoking is interfering with that? If you're vaping nicotine, if you're vaping THC, how is that aligned with your goal of wanting to be really healthy and go to play college sports or whatever? And so we really try to find whatever is going to motivate them. Contingency management, I had no idea what that was until I started working with Dr. Atkinson, and it's something that we've implemented and it's been really, really fun and produced a lot of really positive results. So we give incentives for kids that are meeting treatment goals. So sometimes those treatment goals are clean drug screens. Sometimes you went to school every day this week, and you have a clean drug screen. It depends on the kiddo. We do it individualized based on whatever it is that they need. For one kid, we had just don't walk out of the session and you're gonna get an incentive. Don't storm out of the session, slam the door today, and you will receive an incentive. So we do little gift cards, Whataburger, Amazon, for them meeting treatment goals. And so our goal is not to say, hey, you're doing a great job at doing stuff that you should have been doing anyway. Our goal is to incentivize them for something that's really hard. It's really hard to stay on the right path and do the right thing, especially when you've already kind of veered left. And so we want to give them a little bit of motivation, whether it's external or not, to help them in those moments that are really, really hard. When they walk into the bathroom and their friend says, hey, you want to hit? We want them to go, oh, no, I'm gonna get drug tested and I can get a gift card. And if that helps them get through that moment for the 14 weeks that we offer contingency management, then what we hope is they've developed some good habits, they've developed some patterns, they've developed some coping skills, they've developed some drug refusal skills in that time, so that when their incentives stop, they'll have enough just organic incentives in the world that will keep them from making the bad choices or continuing down that road of using. And so that's really, really fun. It's evidence-based for adolescent substance use and for all substance use, but especially for adolescents, they're very motivated by those little gift cards. In 2022, 50 million people 12 or older met DSM criteria for any substance use disorder. So that's 17.3% of the whole population. Ouch, right? Ouch. Highest rates of substance use were among young adults, 18 to 25. And we know that more than 90% of adults that seek treatment started using in adolescence. So where do we need to target? We gotta work on, all of you wonderful, beautiful women here that do prevention and intervention. That's amazing work. And I think it's not easy and they don't wanna listen sometimes, but it's really, really, really important because we know where the train's going. They don't, but we can see it. We know how the tape plays out. And so sometimes just being able to talk to them and educate parents and families is just really important. 94% of people 12 and older with a substance use disorder never received treatment. And Texas continues to rank pretty poorly in the number of people that need treatment versus the number of people that actually receive treatment. So I know everybody in this room is working hard to fix that. So community needs, what do we need? We need more treatment options for Medicare, Medicaid, and uninsured populations. I heard a few people that I'd like to connect with that offer some of those services. So we do take Medicaid, but we also get a lot of calls for kids that are uninsured, and it's just not something that's really sustainable for our program. And so any resources out in the community would be really helpful. I think, it was a hit when our one uninsured Medicaid residential facility closed here in Dallas. I think that hit everybody pretty hard that works with adolescents. So we need more. We need more. It's really, really hard to place these kids in the appropriate level of treatment when it doesn't exist. Very, very, very challenging. Education for families with high substance use risk factors. So if we know that this family is at high risk, I heard somebody say, I think it was over here, that work with high risk families. Like if you know that family is probably going to have some issues or meets the criteria that they could use some early intervention, I think that's amazing. And it does help. Child teen interventions and education, detox services are very limited, especially for adolescents. So when we do need the detox for these kids that are using fentanyl, and other drugs that require the medical detox like Xanax and sometimes alcohol, it's very hard to find detox beds for adolescents. Services for parents to support getting help for a family member. So sometimes they need childcare, sometimes they need transportation. Medicaid offers some transportation, so we've been able to utilize that, but it's not enough. Community support groups that are geared toward adolescents. There's not a lot of support groups out in the community that are really geared toward young people. There's a few AA meetings or NA meetings that have a more young population that attend, but there's nothing that I'm aware of that's really geared toward this group for substance use 12-step treatment. If you guys know of something else, please tell me, because we have searched up and down. What questions or discussion or? Yes.
I have a couple of questions.
Yeah.
One thing that you mentioned, which is a step that I have skipped over when families are just uncertain about how their child is using, if their child is using, going to the pediatrician, since most of the families I work with are uninsured or have Medicaid. What then? Like their pediatrician does the panel and then the pediatrician doesn't really know the family. What does that family do with that information? Can we then refer them to children's or another like substance use program to evaluate what that comprehensive
Absolutely.
So you
Absolutely.
guys could just accept that. I feel like I call you guys all the time. Because even if you're not serving our kids, you're providing referrals, like whoever answers the phone.
Yes, yes, good,
Okay.
thank you, good to hear.
So we can do that, like I can tell a family, get the information. Hopefully your pediatrician knows what to do with it, but if they don't, this is who you can call.
We really pride ourselves, and I can't speak for the other programs at Children's, although I would think they would say the same thing. We really pride ourselves on if we cannot help you, we will find someone that can. If we're not the next right step, we will find someone that is. And so if somebody calls and they're like, hey, we went to the pediatrician, he's positive for marijuana, what do? We can always assess them. And so, yes, absolutely, they can call, we can do an assessment, we can do an intake. If you're really unsure, you can reach out to me directly. I'm happy to help. There's cards, we have program flyers, and then I brought a few fentanyl flyers too, not very many. Just a few little fentanyl flyers if anybody wanted that information as well.
Okay, my other question was about detox programs, because I feel like I have like always hit a wall with that. I'll have kids that maybe aren't eligible to do medical cities detox, or they don't fit criteria. So what do you recommend for, what happens often is that we'll have kids that overdose at our schools, and then they're transported to the nearest hospital. Right, it's like a suspected fentanyl overdose because we use Narcan and that child is revived. But then hours later, they're being discharged from the hospital. So a lot of these families, what they need is they rely on intervention counselors like myself to tell the family, do not leave the hospital. This is what you're asking for. And these are families that aren't speaking English. And if they don't have insurance, they don't feel empowered to speak up. So how can I equip them with, this is the hospital or detox program? Good recommendation.
It's so hard. And I know we're working with our emergency room too on some of the processes, fentanyl test, it's a little bit better now, but before they would test them, the parents would say, I'm telling a story that I remember. Parents found this child face down, lips were blue, got him to the hospital. He was able to wake up, and was fine. They did a full panel drug screen, but they discharged him.
Weeks later, that they share the information.
No, it was, so he was actually supposed to, I won't get into the whole story, but they discharged him home where he had more fentanyl.
Oh, yeah.
Because they didn't have the results back from the drug screen yet for the fentanyl. And so now the test is a little bit quicker. They're finding it, but like on a 12 panel, if you do a 12 panel, just the cups, fentanyl does not show up on there. Do not think that it's going to show up as opiates on there, because it will not show up on there. You have to have a fentanyl specific test or it will not show up, or do a comprehensive where you send it to the lab. But the 12 panel will not pick it up.
Well, we have our adolescents that are discharged home and are overdosing again by the weekend. So like Narcan on Thursday and then the second overdose on Saturday. And I feel it like if I can't walk that family through the initial piece of the crisis to provide them with, this is the hospital or the location, or this is who or what you asked for, that they're just sent home. Like, so after Narcan, hopefully a lot of you guys are not super familiar with it, but if a person uses Narcan, then they're going, sometimes they're vomiting and they're having those reactions, and so they're getting like a bag for the vomiting, and then they're sent home when they're done vomiting. So what do we do? Like, what can our families do, particularly those? How do we beg the ER at Children's or at Medical City or Presby to keep our kids?
You want to touch on that?
I think, Children's doesn't have an inpatient psychiatrist. So when they come to RED, we assess, stabilize, and refer to other psychiatric facilities in the community if that's what we determine is needed. As I was listening to this, I'm thinking, well, gosh, if a kid overdosed and needed Narcan, I sure hope they get a couple of nights in the hospital to be able to think about it and deal with it. But you get into the issue of if they're not imminently at harm,
Which is difficult to determine.
Insurance
because
is
we are
gonna
not
pay for it.
into what they're taking.
yeah,
And like, I can call everyone in the tri-state area to look for a bed for them, but I can't get it done in 2 hours before they discharge.
yeah, and the facility doesn't want to take them because they won't get paid unless they're acutely suicidal or imminently at risk.
So Poland Springs is a new facility. Are y'all familiar with Poland Springs? Okay, so fairly new facility, and they do adolescent detox, last I heard.
Adolescent detox?
Yeah, they're part of the HCA, like the medical city.
Yeah. Yes, ma'am.
Thank you.
So I used to be a social worker at Children's Plano. So
So I did a lot of those safety valves and stuff. Sometimes the doctors aren't gonna say like, oh, this kid needs to use a social worker for a safety valve, but the parents can always request it. And then I'd be asking that social worker like, hey, I'm not necessarily as concerned about like the mental health stuff, still go over that. But like, can you screen to see if my kid needs detox? And there are some mental health facilities, so like children's using the referral, so like it goes out to all the facilities. And they just say the primary reason is substance use detox. And then like there's some facilities that can't accept adolescents for detox, but they just have to know to ask for that assessment. Because the ER doctors, sometimes they're going quick, they got so many people waiting for them. And so I think it's just knowing to ask for that type of screening. We have some kids come in with, it's the same thing with like eating disorders. How easily does that get missed unless they're coming in asking for eating disorder assessment, you know?
Yeah.
And so, sometimes if they're not suicidal or homicidal, it's just like, okay, treat them and get them out. But I think those things go missed a lot, so I think she's teaching the parents to ask.
And there are conversations happening about some of these things, just to try to make that process a little bit better for the kiddos.
So I guess my question is, when, are the schools notified when one of their children are in the hospital because of this? Are they ever notified? Because those are extra set of eyes that can help the families, and they have social workers and school counselors on the campus that can also.
So, I mean, HIPAA would say that they're not notified unless the parents notify them. So the
Are
parent,
they encouraged to?
oh, I'm sure, because they're gonna be out of school. I work in an outpatient, so I don't deal with that piece, because our kids don't come out of school for our program, but yes, I would assume that you've got to be in contact with the school to let them know regarding the absence fees. And so ideally, I know some parents, there's like this shame thing, they don't want to tell the school that their kid's hospitalized, whether it's psychiatric or substance use. And we always encourage them, talk to the school, because they will help you, they can accommodate, they can work with you, they can work on getting your work even while you're out, so that you don't come back and have a mountain of work to complete and make you more stressed out, you know? So we always encourage the families to talk to the school, but that's not something that any program could do.
And I would add to that, you encourage the family to talk to the school and also say to the school, as I said, our fellow behavioral health is in over 800 campuses. We're in Richardson, we're in some Dallas schools, all over the place. So tell the family to say, are you part of, do you have school telebehavioral health with children? Because that's not gonna fix the problem, but that's another person that's on the ground helping to coordinate ongoing care.
And the therapists that do the school behavioral health are really, they're very connected to us. So we get a lot of referrals that way too. So they might do an assessment on this kiddo that you're concerned about and say, hey, Stacie, we've got this kid that we've been seeing in this school. The parents, we've told them that you guys are gonna be reaching out to them, or we've told the parents to reach out to you. And so we can connect that way too. That might be a good first step, is just to get them connected to the telebehavioral health and let them do a quick assessment, because they'll do the, you know, a lot of substance use assessments, suicide assessments, everything when they first meet with them.
I have a follow-up question. Does Teach Out though, do they work with students that have active substance use challenges?
They work with everyone. I mean, it's all telebehavioral health, so they're not gonna be able to drug test and do a real treatment program.
Okay.
But they too are trained in, you know, some of the motivational interviewing techniques and working with the student and the parents to get them to move to that next step of treatment.
And if they're not appropriate for just that telehealth, then they'll refer to someone who is.
So it'd be a first step. for
They're
families.
great at finding resources too, and I talked to quite a few of them a lot. Yes, Ms. Whitney?
I have this question for you, but also anyone who works with adolescents in the room that have cannabis use disorder. I used to work in a residential program years ago, and back then, if a parent called and their kid was just smoking weed, insurances wouldn't recognize cannabis use disorder, and they don't reimburse for cannabis use disorder. So it's always this dance of, well, are they struggling with anything else that we can work with insurance about. And so I didn't know if you all were seeing an improvement in that because of the severity of the symptoms and side effects and strength and potency. Is that getting better at all?
Yes, yes, yes.
Okay.
It's still a struggle, and so we're not gonna send someone to residential
Right.
until they failed at outpatient.
Right.
Because insurance is gonna be like, well, you didn't try this other level of care first, or, you know, sometimes they come to us for IOP and they're like, they didn't try outpatient therapy first, and so we'll say, okay, we can do just outpatient therapy with this kiddo, but if they continue to use, we're gonna bump them up to doing the groups and everything for the IOP level, so, you know, we work with all of that, but yes, they will take it, and 95% of the time, there's a coexisting
Right.
something going on. Anxiety, depression, you know, some personality stuff. So there's almost always something else that we can justify them being in treatment for.
I have seen a lot of outpatient programs start listing like vaping and cannabis use as an actual thing that they're providing services for,
Yeah.
because that's one of the things that we would struggle with. We would call certain agencies and they would say, unless there's a co-occurring
Yeah.
disorder, we can't take them.
So we always say that they're mental health or behavioral. I don't know who, if they're smoking weed, they're gonna have either some mental health or some behavioral issues that are going on. So I think in the 7 years that we've been there, we've had 2 kids that we just really did not feel comfortable putting a mental health diagnosis on. It's very rare that you can't find something that's going on with them. So, yes.
This is a much more broad question, but I know that a lot of kids get their drugs through Snapchat. Is there anything that's being done? Is legislatively anything to try and like?
God, I hope so. No, I have no idea. I mean, our kids will tell us, I can buy whatever I want in 5 minutes
I mean.
and have it delivered to my window.
They literally have these code words and it's crazy on TV.
No, it is.
Think about that too, to get rid of water, that's something else.
Oh,
Yeah, something else will pop up. Yeah, it is crazy. It's a completely different world. And I have older kids in my life, mine are older ones, and then I have the 12-year-old them. It's just a different world, even between those, you know, just different. Yes, ma'am.
I'm curious if you guys have seen a lot of this, but I've noticed a lot, with some of the students I work with at the alternative program, at our school district. I've seen so many kids lately that are diagnosed with ADHD. They're put on Adderall or, you know, Vyvanse, a lot of them are Vyvanse actually. And then they can't eat. And so they get high to eat. There's like a vicious cycle. You know, it's like they can't function at school without their ADHD meds. Then they can't eat, they would be happy to bulk up and all this stuff, you know? And then so they're smoking to feel like I can't eat unless I smoke. So that's why I smoke. Have y'all seen anything like that, or do you have a thought?
So our program would look a little bit different because we do drug tests, and so they're not gonna get Vyvanse if they're continuing to use, because we drug test
Right.
weekly.
But they're not necessarily abusing the right.
Yeah, no, but they wouldn't even get a prescription for it if they continue to use. Maybe in the very beginning, but if they continue to use, then the doc I work with would say, we're not gonna give you Vyvanse if you're gonna continue to use because it's. Vyvanse, especially, I feel like has I'm not gonna eat quality. That's what I've observed. And I had a child in my life that was on it at one time. And it was always like to eat a really big breakfast before you take your medicine, because we know that it is gonna impact, but it did help so much with behavior that it was kind of that trade-off. Yeah, I mean, I would encourage anybody that's really struggling that much where they feel like they have to smoke to eat, to talk to their doctor about a different medication, because that's just probably not the one for them. Probably not the one. Yes.
You know, I would like anyone's input on resources to help teens understand the current THC vaping situation, because our counselors are having this conversation all the time, where we're like, this is interfering with the psych meds you're supposed to be on, this is causing these symptoms to be worse, but I feel like coming from us, it's a whole lot of wah, 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 wah,
Yeah.
wah. And anything out there that's like videos geared towards teens, by teens, maybe, social media influencer that's out there speaking to this, just something that's not our professionals,
Yeah.
yada, yada, at our kids about that.
Yeah, there are a lot of good videos.
They do get like outdated really quickly.
They do
Yes.
get
And
outdated.
they're like,
Strategy.
yeah. Passionate enough content.
We go through our group curriculum pretty often and go, I don't really like that video anymore. There's a couple of oldies but goodies though that you just gotta keep around because they're just good, but yeah, they do get outdated really quickly, so that's true. There's, I mean, YouTube rabbit hole right there, like you could just go forever, but I'll see what I can drum up and see. I can't think of one, I'm trying to think if there's one that specifically talks about like the potency and the psychosis and like really digs into the cannabis, but I'll see if I can find something and if you'll give me your info, I'll shoot it your way. I know we talk about it, but I don't know that it, can't think of a video that we showed that's that specific.
But you do get.
Yeah. Yeah. Oh, good, thank you.
But you also sometimes get that, going in the group format.
Oh, yeah.
Because, you're constantly bringing kids into group, and then you have ones that are closer to finishing the program and being successful. And when they speak up, I mean, that's part of the success of group therapy, is that they can learn from their peers. Sometimes they learn bad things, but,
Try to limit that.
yeah, but they can see, oh, okay, this seems kind of cool, and
Yeah.
hear it from them.
Yeah.
Run into that problem, I'm sorry.
Go ahead.
I'm totally an interrupter.
No, you're good, you're good.
There. What was that?
I don't know.
Oh, the whole point of adolescence is sometimes that you give them that information, they don't think it's going to happen to them, they cannot relate to it because they think they're immortal. Oh, that's not going to happen to me.
I always go back to like when I was in elementary school, which was a really long time ago, and they would show you those like, just say no, dare stuff,
DA.
But like the videos that they would show would be like, the homeless guy, in the gutter, and I'm like, you can't even relate,
Right.
like you can't relate to that. And so I do appreciate that it does seem like we're trying to show them things that at least are more relatable now. That this can happen to you, it doesn't matter where you're from, it doesn't matter, I love where we work because we're in Dallas. And we have, we have the kids from Highland Park, and then we have the kids from Oak Cliff, and, all these other areas, and we see them in the same group, and they're in the same place, and if anybody ever questions it, I'm like, guess what, they end up in the same place. We end up in the same jail, we end up in the same cemeteries, we end up in the same, it doesn't matter where you come from, this is gonna end the same. You might have a better legal battle on one end, but, you're still gonna end up in the same place, so I think drugs don't discriminate, so.
Thank you so much.
First, thank you so much, Stacie, for doing this. It meant a lot. It was really great, wasn't it? If you came into the meeting after we talked about this is our registration way of registering for the attendance. And this way, Holly will send out to you a video recording from Stacie's presentation. It's also a way if you don't get to meet or grab someone to talk to, you're like, gosh, they talked about this, I want to connect with them. We can share your email with them. So please register if you'd like to be included on the email. And then the other thing is we're just going to do one of those selfies, or big shot, because I love this view and y'all don't get to see this view, but I love seeing your face. I always take it from back there. kind of boring to see backs of heads. So if you're okay with this, we'll put CO up here, take a group shot, wave, whatever, and then we are adjourned. Thank you. Okay, you want
Yeah.
the back to stand up? Or
Yeah.
all of us?
The back to stand up and then like the side people right here.
Okay, can y'all just stand up and squeeze in a little
So we
bit?
really
You want to get all of them.
Yeah, I do.
We're fine.
Well, let's see.
Okay, does that work?
Yeah. We'll get there.
We're ready, go.
I'm gonna take a lunch though.
Okay.
Okay. Ready?
Oh my gosh, wait, this works too.
Okay. You guys all look so great. I think that's good.
Thank you.
They might think it's less fun.